Here are a list of different bacterial zoonoses, and I would like to encourage you to please go online and see if you can take each of these diseases and Google it and see what you come up with, because there are very good descriptions of the diseases on the internet. We're now going to go through the most important of these diseases in more detail. The first one on the list is a very serious disease called anthrax. In South Africa, we control anthrax mainly by vaccinating cattle. Here you see a history of a 30-year-old woman with abdominal symptoms who went laparotomy and died 12 hours later. The surgery showed ascites, an edematous small bowel loop, and huge mesenteric lymph nodes. This woman probably had eaten an animal that had died of anthrax. This is fairly common in Africa today because people are very hungry, and if you get an outbreak of anthrax in a herd of cattle, you have many deaths. Recently we had an outbreak of anthrax in elephants because of malnutrition, and the drying up of the water landed up with a huge amount of anthrax spores being ingested by elephants. People who ate the elephant meat had the risk of dying of anthrax. You can see what the intestines looked like afterwards when the person had died, and there was an autopsy done. So this is a very serious disease in Africa today, and basically controlled by controlling it in cattle, where if you vaccinate the cattle, you don't get anthrax, and then you don't get deaths. The state veterinary services vaccinate all the communal cattle every year. Bovine brucellosis is a very important zoonosis in South Africa. There are other species, but Brucella abortus, which found in cows, is definitely the most important. It can even penetrate the mucous membranes and the conjunctiva in farmers. You can see the cow in the little picture on the right is flipping its tail, and if it has got brucellosis, fair chance it could flick some birth fluid straight into the eye of the farmer that is patting it. It's also transmitted by unpasteurized milk. In abattoirs during slaughter, there's an awful lot of blood that comes out of a cow, and this can be aerosolized, and it tends to get into the lungs of abattoir workers, especially those who do not have adequate PPEs. The prevalence in cattle in South Africa is between 1 and 15%. So many cattle farmers, abattoir workers, and veterinarians are infected with this disease. It's another disease that's not easily diagnosed. People just get a migraine, a bit of a fever, and they don't worry too much about it. As a result, it is sometimes diagnosed or misdiagnosed as malaria. The treatment is through doxycycline, and it is very effective. Enterobacteria are very common in dirty water. Some of those that we have in South Africa is Campylobacter. It sometimes causes mastitis in cows, and also there is fecal contamination of raw pasteurized milk and raw chicken. It's called traveler's diarrhea because often if you go to different countries where the water purification standards are low, this organism flourishes. Salmonella typhimurian and Salmonella dublini are present in the feces of carrier cows, and there's also a Salmonella which is present in chickens and can infect people who eat undercooked or raw eggs. Other enterobacteria that are important are E. coli, especially E. coli 0157, and Shigella, and these are related to raw sewage and fecal matter and lack of personal hygiene. Many of them are resistant to antibiotics, and they're a common cause of death in children from diarrhea and also in immunocompromised people. Listeriosis outbreaks occurred in South Africa in about 2018, and this was as a result of a meat packing company that unfortunately did not clean its cutting machines and packing machines properly. They were refrigerated and they thought that keeping them cool was enough to keep them clean, and of course it wasn't, because Listeria is a cryophilic bacteria that grows easily in cooked food, grows easily in cheese. These supermarkets that have dishes of food made in the morning that you can help yourself to all day also lend themselves to infection with listeriosis, because it grows in refrigerators and contaminates ready-to-eat foods. It causes deaths in the elderly, and also it's very, very dangerous for pregnant women, as a baby can be infected in the womb, with late miscarriage and neonatal deaths if the mother is a carrier. Fortunately, it's very susceptible to penicillin, particularly ampicillin, and you can treat it with ampicillin intravenously. This is called diamond skin disease, and you can see why. There are diamonds on the skin of this pig. The symptoms in humans include erysipeloid, which is a localized cutaneous swelling, especially in the hands, round about your wrists and above your thumb. You get swelling and severe pruritus and pain. There are also sometimes generalized cutaneous lesions which look very similar to the diamonds on the pig's skin. Unfortunately, it can result in endocarditis and monocytosis, and people can die. Fortunately, it is also very easily treated with penicillin or penicillin and streptomycin combinations, if it is diagnosed in time. Fortunately, there is a vaccine for pigs, and commercial pig farms use the vaccine. However, we do see cases in communal pigs. Leptospirosis is picked up from water that is contaminated with rat feces. Dogs can also get leptospirosis, but there is a vaccine. Pig carcasses in the abattoir can transfer leptospirosis, and we have had cases where leptospirosis was transmitted by pigs drinking dirty water. It's an occupational hazard in Europe with people who go out and do water sports. During the war in Europe, occasionally the resistance pushed the Nazi soldiers into the canal water, which was infected with leptospirosis, because during the war there were a lot of rats that came out of hiding and polluted the canals. These soldiers landed up in hospital, and instead of going back to war, they had to be treated for leptospirosis, which caused a hemorrhagic bacterial fever with kidney failure.